Hello friends, let us now learn some important points about the consolidation. So if you see the radiological and CT findings of consolidation, we can see homogeneous opacity obscuring the vessels, air bronchograms, ill-defined and fluffy opacities, air alveograms, patchy opacities, acinar and airspace nodules are seen. We have already dealt with homogeneous opacities obscuring the bronchi and air bronchograms. Okay, now let us learn about the ill-defined or fluffy opacities. So we have ill-defined or fluffy opacities. So whenever there is consolidation, the consolidation may also present as ill-defined or fluffy opacities. So these ill-defined or fluffy opacities are seen as patchy local spread disease. This can be patchy locally spread disease is seen in whenever the consolidation presents with ill-defined or fluffy opacities. Okay, it is patchy local spread of disease is seen here. Okay, then here if this consolidation, if the consolidation or this patchy opacity is bordered by interlobar fissure, if it is bordered by interlobar fissure, that means if this is present near to an interlobar fissure, any interlobar fissure, then you might see this fissure, or we might visualize this fissure has linear opacity. So this fissure is seen as sharply margined fissure or linear opacity. The fissure might look like linear opacity. So if you see in this picture, this is the whole lung which is showing the ill-defined fluffy opacities. These are fluffy opacities or ill-defined opacities which are seen. And here this is bordered by this, if you see this line, which is actually the fissural line, because here this is interlobar fissure. Because this consolidation is bordered by this interlobar fissure, you can see the thickened interlobar fissure or sharp interlobar fissure which is visualized here. Similarly, this is a CT picture which is involving the right lower lobe pneumonia. Here you can see these some areas of air alveologram are seen actually, and they can also see focal lucencies. These we will see again now. Now actually you have seen about these are the fluffy opacities with interlobar fissure is seen, right? Next. The next we have air alveolograms. Followed by this, after this fluffy opacities, we also have second type, fourth type of defect which we can see is which is associated with consolidation is air alveolograms. Okay, what are these air alveolograms? Air alveolograms means if the consolidation of the lung is not homogeneous. If it is not homogeneous, that means if there is heterogeneous, that means if it is fluffy opacities are present. So if you see, if I draw if this is the lung here, if there are fluffy opacities are seen, just imagine there is fluffy opacity seen here. Okay, so between the fluffy opacities, okay, so these are actually fluffy, ill-defined opacities or focal lucency, sorry, these are actually ill-defined opacities which are seen. Okay, if there is ill-defined opacities are seen, okay, in between the ill-defined opacities, there are certain regions of uninvolved lung. So between the ill-defined opacities, we will see areas of uninvolved lung. So these areas of uninvolved lung, which is seen between these ill-defined opacities, is called as air alveologram. What is air alveologram? It is actually the area of uninvolved lung. So here this is not involved. Even this is not involved. So it is present in between ill-defined opacities and it is not involved. So that is air alveolograms. So if you see here, this is a fluffy opacity. But here see this part where there is uninvolved lungs, which is air alveologram, which is actually An uninvolved or normal lung which is present between the fluffy opacities is called as air alveolograms. Okay. Then the next important change of the lung, which looks like a consolidation, is a patchy opacities. Okay, what are these patchy opacities? Patchy opacities are again variable areas of consolidation, which is seen in the lung is patchy opacities. Okay, so these patchy opacities are like different patches of opacities are seen all over the lung or at least some part of lung. So these patchy opacities might be present either might involve a single lobe causing lobular disease or it may be involved in multiple lobes causing multilobular disease. On CT, it can be either a single lobe or multiple lobes can be involved in this patchy opacity. So whenever there is patchy opacities over wherever they are present, that lobe will look dense when compared to the other lobes. So if you see here, these are different patchy opacities which are seen in the chest radiograph. These patchy opacities are present on the around the hila. So these are patchy opacities seen in perihilar region. Similarly, if you see this CT, you will see patchy areas of fluffy opacities or consolidations are seen here. So all these are patchy opacities which are seen here. Next, these are also presence of some patchy opacities are seen here. So this is a patchy opacity which is seen on CT. These are also different patches of opacities which are seen in CT. The next important thing is about the air space or acinar nodules. Then the next consolidation change or the change which represents consolidation include acinar or air space nodules. What does this acinar or air space nodules? Acinus is actually the alveoli along with the uh, terminal bronchiole, which is the terminal unit for gas exchange, is called as acinar or airspace. It's called as acinar. Okay, this is after the terminal bronchiole, distal to the terminal bronchiole. Okay, and this is actually supplied by first order respiratory bronchiole. So this is acini. Okay, this acini average diameter will be 7 to 8 millimeters, and this acini actually involves alveoli plus first order respiratory bronchioles. Okay. Then what are these air space nodules? What are these air space or acinar nodules? In air space nodules or acinar nodules, you will see these nodules are 5 to 10 millimeters in diameter, and these occurs whenever there is focal consolidation is seen. So in the presence of focal consolidation, you will see these air space nodules. These air space nodules are poorly marginated, rounded air spaces. These are poorly marginated and rounded opacities are seen. So in the lungs, whenever there is air space nodules, the consolidation might be seen as small nodular structures which looks like airspace nodules. These airspace nodules can be either centrilobular, most commonly, which is involving the center of the lung or center of the lobule, or there can be peribronchial, that is present around the bronchioles. So these can either be centrilobular or peribronchiolar. So these nodules have approximately the size of acini only. So has already said the size of acini is 7 to 8 centimeters. So airspace nodules are also around 5 to 7, 5 to 10 millimeters in. These are 7 to 8 millimeters. Acini is around 7 to 8 millimeters. Similarly, airspace nodules are 5 to 10 millimeters with focal consolidation noted. And these are seen as rounded opacities. Here you can see these rounded opacities which are seen, and these are less than 1 centimeter in diameter. Okay, and these are called as airspace or acinar nodules. So here in the CT you can see presence of bilateral consolidation, and you can also see presence of these airspace nodules. See, these nodules which you can see here are airspace nodules. So here you can see one important thing here is airspace nodules, which is a feature of consolidation. Then if you see, one more important thing about the consolidation is, in consolidation there is preserved lung volume. That is the main difference between consolidation and collapse. In consolidation the lung volume is preserved, because actually the lung is normal, and inside the normal lung we can see that the lung is filled, the alveoli which are present in the lungs, and they are filled with water. Instead of air, they are filled with water. So obviously the lung volume is normal, but it is filled with water. So as a result, it appears to be opaque. So volume loss is not generally seen in consolidation, but a minor degree of volume loss might be seen. Then we have extension to pleural surfaces. In extension to pleural surfaces, right? In extension to pleural surfaces, consolidation, actually, if this is one alveoli, so from one alveolus to other alveolus, the consolidation will start spreading. Okay, if this is consolidation, it spreads from one alveolus to other alveolus, and finally, from one alveolus to other alveolus, it spreads, and at the end, it reaches the fissure. Either it reaches a fissure or it reaches the pleural surface. Okay, when the extension to pleural surface appears, then it is mostly present, mostly involves the complete lobe. So so thus we can call this as a lobar pneumonia. Okay, so whenever it enters into the pleural surface, that means the whole of the lobe is involved. So in such cases, the lobar pneumonia is seen. Then the last important feature of consolidation is CT angiogram sign. We have a sign called as CT angiogram sign. This CT angiogram sign is seen in patients with consolidation. This CT angiogram sign is that here you first give an infusion of IV contrast is given to the patient, that is CECT. So you will do an IV contrast is given to the patient. And when you give this IV contrast, you will see presence of opacified vessels are seen. The contrast opacified vessels are visible in the presence of contrast. So these contrast opacified vessels will appear as a CT angiogram sign. CT angiogram is almost equivalent to air bronchogram, but it is vascular equivalent to air bronchogram. So if you see this, here you have given the contrast, and you can see the contrast filled vessels are seen here. Contrast filled vessels are seen here, which appear denser than the surrounding tissue in CT scan. So these are the important radiological features of consolidation. Thank you.